हेलो एवरीवन।
अभी आए ही नहीं कोई। हेलो एवरीवन। पहले आने दो, सबको बोलो हाँ वो हेलो हेलो हाय हाय ऐसा करके बोलो।
हेलो।
कोई आया नहीं है। यहाँ बंदों का नंबर लिखाएगा। ओके।
हेलो। हेलो एवरीवन। हाय। हाय। Hi everyone, this is dietitian Preeti Gupta. Today I am going to do a live session with dermatologist Dr. Swati, and she will be joining in a moment. And first of all, let me tell you about myself. I am dietitian Preeti Gupta from Perfect Health by Preeti Gupta, and I have 16 years of experience. And today we are going to take the topic of skin. So how can we make our skin glowing, and what are the roles of vitamins in our day-to-day life, and how can vitamins enhance your skin? So Dr. Swati, dermatologist, she will also guide us on the same, and I will tell you about the nutrition part, what food items and how can you replenish your skin, and that's why I'm just waiting for her to join. Let me see if she can join. Just a moment. And any questions, any queries about skin, you can just DM us so that we will be having your answers, and you can easily do that. So I've just invited. Let me see that if she comes. Yeah. Hi, Dr. Swati.
Hello, Preeti ji. How are you?
Fine. Aap batao. How is everything? Now, simple introduction about Dr. Swati. Dr. Swati is a MD and gold medalist in dermatology, and she has a lot of experience also, and she has Skin Nation clinics in Chhatarpur, Faridabad, and Vasant Kunj. And she's here. We are very delighted that on the special occasion of Valentine's, you are here to guide us on the skin topic. So let's see what vitamins are we going to talk about, Dr. Swati, today for the skin, which are very important. Tell
Uh,
us.
yes, there are various vitamins that taken orally also help, and when used as ingredients of skincare regimen also play an important role. So we can take up vitamin A, C, vitamin E, K as it goes good for you.
That is true. There are so many vitamins, minerals, everything is needed for our skincare when we talk about. So let's see. First, we'll start with vitamin A. So when we talk about vitamin A has two types. So we all know that one is the active form and one is inactive form. Where is the inactive form is the beta carotene, which is the various in the vegan sources like your colored vegetables and fruits. It comes from, and if you take your carrots, your sweet potato, then you get enough of vitamin A. But if it is active form, then it is in the egg, in the milk sources, the dairy sources, and the meat and liver. So these are the various sources, and vitamin A is very important for our vision also. Then even the skin health, it is very important that you will tell us, and various other cell repairs and all the other things like your muscle mass and your bone degeneration. These are all things which are important. So tell us more about vitamin A now. Thank you.
Yeah, so see, vitamin A, when we use it in dermatology, there are basically two ways we use it, either orally or topically. So coming to oral uses, when we talk of vitamin A, actually we are talking of various vitamin A and vitamin A analogs. So orally, these components are used for treatment of severe type of acne, treatment of skin conditions like psoriasis. And coming to topical use, see we have retinaldehyde, and tretinoin. So,
Okay.
this is one of the part of the aging strategy regimes that devise for our patients. So how it works is, see, vitamin A is a great skin regulator. They are cell regulators. So when a patient has photo damaged face or they have fine lines and they feel they are patchy, so they work on those parameters. That is when topical vitamin A is recommended and works really well in working on those wrinkles and signs of aging. So that's how vitamin A helps.
Yeah, that is great to hear about it. And now let's talk about vitamin C also. As we all know, vitamin C is a rich antioxidant, And when we talk about vitamin C, so in this pandemic time also, vitamin C was the most needed vitamin which was there. And it is there in the amla, your gooseberry. Amla is the best source of vitamin C when we talk about. And again, it helps to repair your skin. And again, immune function is the best. Then these are the simple collagen synthesis also. Vitamin C is required. So vitamin C sources, we all know it is the mainly fruits and vegetables, citrus fruits, and green color vegetables are also good sources. So you can include these sources, and sprouts also, germinated sprouts, if you include in your diet, that will also give you vitamin C. So you can include that in diet. Now let's see the importance in the skin also. Okay, what is the importance? You can tell us more about
Yeah,
it.
so again, to this vitamin C. So see, again, depending on whether you are taking it orally or you are
Hmm.
applying it on the skin. So orally, as you said, it's a very important ingredient of our diet, the fat soluble vitamin. So what we come across if people are vitamin C deficient is there is delayed wound healing, there are curly hairs, there are bleeding, especially bleeding of gums. So, and if we talk of how it helps topically, see, topical vitamin C is a great antioxidant. It is one of the best antioxidant that can be prescribed for topical use because it has, see, as we age, we don't only get dull, we don't only get pigmented. The collagen also is cross-linked, which is a sign of aging. So vitamin
Hmm.
C, new collagen formation. Vitamin C works on pigmentation and
Okay.
therefore a great ingredient for anti-aging strategy. But I would want to mention here, as we know, when we go to the market and we want to buy our cosmeceuticals and ingredients to be used on skin, so people do come to us saying, "Doctor, I'm always in a dilemma. There are hundreds of vitamin C I know." So not that all topical vitamin C's will be effective because when it comes to topical vitamin C for skin use, there are two very major challenges. First is whether it will be stable or not. A second, whether it will penetrate our skin or not, right? So
Oh,
by
yeah,
stability, I mean
that we
you
didn't know.
all have seen that when you pick up a vitamin C bottle, after a few days, it changes its color. It becomes darker and you feel, oh, the color. So basically,
Yeah.
because it is oxide, right? So it is no more. And second is penetration because it's water soluble and our skin is not, water attractive. Our skin is hydrophilic. So most vitamin C's do not penetrate.
Okay.
Therefore, we use the right vitamin C so that it is stable, it penetrates our skin, the right pH. And then when it's used in that way, it works really well. It's
Well,
again very, very
so it helps in the shining also of the skin, giving this.
absolutely because fine lines on dullness, on the melanin, it really works on the dullness of skin also.
Okay, that is great, well, because we didn't know about the vitamin C that it is not being absorbed if we apply it like that. So we have to consult our the dermatologist. Then only we will be able to know how to apply and how to have taken care of it. Now, next we'll take about vitamin E. I think so that we also know that vitamin E is the best source. जब हम स्किन की बात करते हैं तो and again for immune system के लिए भी it does wonders for vitamin E, and vitamin E is again very good for your healing also. So major things we can cover like vitamin E का आपका sources है, we see like nuts हैं, seeds हैं, then your oils हैं, ghee is the best source if you take, avocados are there, then again green leafy vegetables maybe you get plenty of vitamin E. So vitamin E का अगर हम बात करते हैं तो nuts and seeds are the best thing. So sunflower seeds and your almonds, walnuts, these you can easily have so that your skin can glow, and this helps in the glowing of the skin also, I think so. So let's see about how the vitamin E also helps our in our skin matters. So just guide
Yeah,
us.
so see, I said, yeah, in diet, we can not neglect diet if we want a healthy skin.
Yeah,
So I think
true.
that's why we're talking in a collaboration to understand that skincare regimes are important, but diet can't be neglected.
Mhm.
So vitamin E, when taken orally,
Mhm.
it prevents dryness of skin, it prevents seborrhea-like conditions of skin. So when it is deficient, you might know it that way. Then coming to topical use, see, vitamin E is good when, for the smoothness of skin, it hydrates the skin. So basically, for the signs of dryness, for the
Mhm.
loss of softness, fullness of skin, vitamin E works well. Although studies say, it works better when it is combined with vitamin C. So if I choose vitamin E preparation, they are mostly available as moisturizers, so they help maintain the hydration of skin. But it works
Okay.
well when it comes to anti-aging regimes and glowing regimes when it is combined with vitamin C. So that's how it plays a better role there.
So I don't think so that we need to take a supplement for the vitamin E. I think so food supplements are mostly available. So we can take that. What do you say about it?
Absolutely. I also agree, Preeti ji.
Yeah.
Foods should be your medicines rather than supplements. So eat
Yeah.
well to get the oral recommended doses, especially when we talk of vitamin E, which is a fat soluble vitamin.
That,
You know that.
that's
We
what I'm
don't
saying.
of that with the supplements. People do that. They come to us and say, I've been taking vitamin E daily for a year for good skin.
Uh,
So we have to
uh,
that shot.
Yeah,
It's not
too much
right. Yeah.
also and other problems also comes in the organs because when we are taking too much of fat, it is a fat source only. So when you are taking too much of fat, then also the problems comes because organs may it is not able to absorb properly. That is a basic thing. So these are the some vitamins that we were talking about, and some minerals also I think so are important. I think so that are important for our skin like zinc, selenium. These are also should be applied or topically also and can be eaten in our diet also. I think so that we can
Yeah.
do.
Role when it comes to diet because they are in various pathways that are linked with the functioning of these melanin synthesis and
Hmm.
various such stuff. So zinc, selenium, copper are a very, very important ingredient. When it comes to topical preparations, more of polyphenols, flavonoids, they actually add to the of skincare depending on the indication you use them.
Yeah, but when we talk about the diet, so in diet also the zinc, selenium, these plays a very important role. So the major sources which we should include in our diet are mainly fruits. So fruits are plenty of antioxidants when we get it. Then our vegetables, they are again giving you so many vitamins and minerals. And then your fiber-rich food. So we should not never neglect about our gut because when it is a digestive system is healthy, then only it will show on your skin because sometimes what happens there is a constipation inside and then your face shows the acne and everything, so that is also a problem. So the diet should be your healthy diet, balanced diet, and food groups should be all groups should be included, I think so. What is your say on this, Dr. Swati?
I agree. So vitamins, minerals, essential fatty acids,
Everything should be there.
everything it should be a balanced diet.
Yeah, that's why I'm saying. Because the thing is that people think that they just avoid carbs and think that they can just get the healthy skin by just drinking water only or having fruits and vegetables. But I don't think so. That is the right approach because eating wholesome carbs are also important in that. And even proteins play an important role. Again, protein build up the cells. So protein has an important role also. So as we all know that the Valentine is coming. So in the Valentine, what do you suggest that a person should have an approach towards our healthy glowing skin? So what is your say that?
So first is on your page, I must have mentioned, and I have to mention, nutrition always stands as the first important thing according to me. Also, then comes hydration. People eat well, they don't drink well. So 2 to 3 liters of water daily is needed by all adult meals. So that should not be neglected. Third is sun protection. So I would say diet, hydration, and sun protection. Again, people neglect sun protection, thinking, it's not sunscreen that they need daily, or they are working from home, so they don't need sunscreen. So that's not correct. So that stands in the beginning of what should be your, first steps toward anti-aged and glowing skin, right?
True.
So these are the basics.
So because the
Then
sunscreen, yeah, when you talk about sunscreen, we all think that if we are at home, we need not apply that. And that happens when most of the, I think so, people think about it. But that is a very good point that you brought, that it is needed in our home also if we are sitting, because the UV rays can come from your windows or anywhere. If you're going stepping out also, then also it comes. So that should be applied, and it should be applied only once a day, or it can be applied more than that.
no, actually, it should be applied. Actually, basically, it should be repeated after, say, 3 hours because sunscreens don't stay effective after that time. So, say, for
Okay.
example, for application you do in the morning, say around 9 a.m., then 12 noon, you should, even if you are totally indoors. So, it
Okay.
has to. Yes, 365 days a year it should be applied.
It should be applied. Yeah, that mistake I think so everybody is doing, and that's why their skin is getting tan and everything inside the house also. That is a
Right.
basic thing. So this is the major thing. So let me talk about the nutrients also, which are needed mostly for the healthy glowing skin. So beta carotene that we have talked about, vitamin A. Then lycopene is very important. Again, tomato, we should have it properly. अगर tomato भी आप two tomatoes also if you are having in a day in a salad form or in a juice form, cold pressed juices, then also it is very good for your glowing skin. Again, then minerals may then vegetables we have included. Proteins, maybe lean protein sources are good. If you're taking dale and if you're taking soya protein also, that is also a good source. And eggs are also good source. So these things, because biotin I think so is also needed for our skin and hair. So biotin is available in your egg sources. And then you can include your peanuts also. Peanuts are a very good source of vitamin E, and there you can get the proper nutrition. And as Dr. Swati said, that water is almost needed, a lot of water that we have to drink. And in the when we talk about water, it should be like it if we can do the detox water, like we can dip the cucumber or lemon inside the water, because what happens, the water becomes alkaline in that time. So alkaline water again will be helpful for your detoxification of your stomach also, and for your skin also. So that is also needed. So that is very kind that you have told so many things that we can follow it. And just tell us some things also that we should avoid when we are looking for the skin routine, that what to follow.
Yeah, again, a very good question you have asked. We always talk about what to do. It's very important
Yeah.
to understand what to do. So, as everybody says, so right, do not take a lot of stress. Do your
Mm.
exercise, your meditations that helps in your, de-stressing yourself. Then avoid smoking, avoid a lot of exposure to pollution.
Yeah.
Avoid junk food. That also is something we all know. And always,
Mm.
always get your daily routine regimes for daycare made with your dermatologist, because everybody needs a customized daycare routines for them. It should be more than a habit rather than just being a routine. So
Okay.
that is a very
That is great that we should know these don'ts also, so that we can. Hello. Yeah, it
yeah.
was paused. The poor connection. So I was just asking, can you tell us about the sleep also? Sleep also affects our skin pattern.
Yes,
Skin, yeah.
absolutely. So see, our body has a circadian rhythm. Our body senses when it is time to rest and when it is time to wake up. A very interesting thing I would want to quote here, since you have asked for sleep. There are many patients who come to us and they say we work overnight and our under eyes start looking,
That's
and when
true.
our under eye looks better. So this is something they notice themselves. So it is scientifically also known that under eye region skin is very thin and it has very fragile vessels. So when you don't
Okay.
properly, you are all the time on laptop. There's a difference. When we talk, we blink. When we are on laptops, when we are watching the movie, we are doing concentration work. We are just we are wide awake. So we are doing it
Yeah.
with a lot of concentration. That results in venous stasis. That is, blood starts to
Mm.
accumulate under the not being able to wash off by the blinking process. So,
Mm.
so that's very common as tired, dark under eye people who work overnight or take enough
That-
stress. It affects the look also, but pretty well easily seen around the eye region.
Yeah.
So yes, it definitely affects.
So sleep should be proper, and stress should be reduced. And for reducing stress, we can use the pranayama techniques also. So the breathing techniques, long breathing techniques, these can be applied, and they can relieve the stress also for that reason. Okay. And anything else you want to add, Dr. Swati, for this information to the
Yeah,
audience?
to, yeah, because we were talking about sleep and vitamins, so it came to my mind. So see, there's another vitamin K, that are available in many under eye creams. So some people ask us,
Yeah.
do they really work? So again,
Mm.
we're discussing about the stasis. Under eye looks dark for various reasons. One of that is blood stasis. That is when we don't blink it properly or we are in concentration work. So the
Okay.
fragile vessels tend to leak their blood. This is how it is known medically, that leaks its blood, which is called as venous stasis.
Mm.
So when you buy those vitamin K under eye creams, that component of your under eye pigmentation starts to improve. And that's how another vitamin that we discuss is
I-
K. And
Mm.
it is an important, a very good ingredient for stasis induced, tiredness induced under eye pigmentation. And
Okay.
therefore it works really well in
So
such preparations.
that has to be applied topically again, vitamin K.
It is available topically, and
Okay.
these creams actually help in lightening because of the venous stasis component of the under eye pigmentation. So again,
Okay.
vitamins doing wonders.
That's true. Vitamins and vitamin K again, we can have in green leafy vegetables, broccoli, spinach, kale. So we can have the juice also. These vegetable juices you can easily have. So they will provide you good nutrition for your healthy skin and your gut also. So let's take some questions. I think so. Some of the questions are there. One or two questions. Like
Sure.
I'll see. Dilpreet Chabra is saying my face is oil. I think so. She's asking like she has a oily skin and she wants to know about it. I think so, because I'm not clear that she has said. So you can just
Yeah.
say about olive skin, huh? What we can do that.
Right. So see, when we talk of a face that is oily, there are few things that we need to know. For example, see, oily face, when we come to the regime that we made for the daily habit, face washes should be one that should take off the oil from the face. So salicylic acid, glycolic acid face washes are for oily face patients. Even after
Okay.
washing the face, if they still feel that the face looks oily, then the second thing that they should use is a toner. For a very
Okay.
oily face, you can use it twice every day.
Okay.
Right. So toner comes after cleaning.
Okay.
Then again, application, whether she wants more work on color or she wants more work on aging, she should
Okay.
use her like vitamin C or vitamin A is the best bet, depending on anti-aging or photo damaged face, fine lines. And
Okay. Mm.
various things that she should use on her face should be the right preparations. Because oily face patient again feels that they are getting acne more prominently, and their face is very sticky moment they use some. So another very important thing for oily face patient is their routine moisturizers and sunscreens should be gel based.
Gel based. Okay.
The,
Because
the vehicle ingredients are
mm,
made should be based, and that is how they always help an oily
yeah,
face patient.
that is true, because the people, what they think, that they go in market, they just purchase their products and just apply on the skin, but that is not true. If they should know their skin type, only then they, what the dermatologist recommend, then only they should think about it. So but people don't think about it, no, they just buy it and their face becomes oily more because of these. Now one question from Sangam Kumar, that is, how about the vitamin K creams, are they helpful? So you have just said that it is under eyes cream, I think so, for the vitamin K. But again, yeah, just have a light on
Yes,
it.
yes, that question. So vitamin K creams are best used in dermatology for under eye pigment. That is where I find them very effective. And we have
Hmm.
just discussed that the venous stasis, the tired, overworked under eyes, because of the blood that stays there
Hmm.
for long as we are not blinking properly. In those conditions, when you use vitamin K under eye serums and creams, it works well. It
Okay,
makes.
that is good. Now, one question from the Max. What to use for tanned skin? So they are asking if there's a tanning on the skin. So what should be used?
All right. So see, now, Preeti, when we talk of the approach of a particular condition that we want to correct, we have to understand first is the daily routine use. What we use, what we say a cosmetological approach, that we apply right thing. Second comes the proper dermatological advices, which includes the lightening creams, the lightening serum, and
Mm.
the actual ingredients that are known to. And the third comes the procedural interventions. So
Okay.
basically, when you have tan skin, first is obviously we don't want it to tan any further. So the
That's
first thing
true.
is right face. As you were discussing, Preeti, that
Mm.
sunscreen we apply 365 days, it should be repeated.
Mm.
But people tend to forget and tend to overlook this fact that they think we have applied sunscreen, now we can be on beaches for 10 hours. So it's not
Yeah.
true. You would then also, if you don't take physical protection, so cover your face, take a wide brim hat, take a stall. Nowadays masks help people when they are in sun. So that's a very important thing for tanned skin. Then
Yeah.
comes to how do we treat. So there are many say topical lighting preparation. Consult a doctor always, because if you use over the counter products too much, too often during the day, it can actually irritate you. But yes, there are various preparations like hydroquinone, glycolic acid, they are kozic acid, azelaic acid. They work really well in bringing back the color which is tanned. And then
Mm.
procedural interventions that includes chemical peels, laser treatments, and various
Okay.
other treatments like mesotherapies that can bring back the lost color. So
Okay.
start at the beginning, and the your topical medicines, and then your procedures to work on the tanned skin. But
That
always keep your dermatologist with you for all these advices.
that is true because people don't think, they just apply the home remedies only, and sometimes their skin is not used to that, and they feel then overall problems comes, and then they think that where to go. So they should first of all go to the dermatologist only for these problems. Then only their problem will be solved. Now, one more question I've seen: what should we drink? Dilpreet Chabra. I've told you that for glowing skin and for healthy skin, you should have lots of water. That Dr. Swati also mentioned. You can have a vegetable cold pressed juices. They are very good for your glowing skin. And you can have a detox water also. Like in the water, you can have just cucumber or mint, anything, whatever you have want, like lemon slices also, pineapple, you can just put in the water and have that drink. Just keep it and have that drink. That will be very helpful, as it is the flavors are there, and again, alkaline waters are helpful for detoxifying your skin and everything. Now, one more question, Dr. Swati: which is better for skin, vitamin A cream or vitamin C? So again, the same question, I think so, but just a small thing, you can just put your input.
Yeah, absolutely. So see, vitamin C, just because this question is asked, Preeti, I'll just clarify it. Vitamin C is a very rich antioxidant. I would say one of the most powerful antioxidant. And vitamin A is a cell regulator. So
Hmm.
that which one is better, honestly, let them not because they are
Yeah.
all both very good in their own ways. Vitamin C would we prefer when we are working on color, when we are
Okay.
working on the damaged and fine line face, right?
Okay.
Vitamin A is then when it's a photo damaged face where we want to work a lot on the texture, on the
Hmm.
wrinkles. So
Hmm.
it's a cell regulator that would work on also acne. So that's
That.
the vitamin A. Also, another important thing, interestingly, because somebody has asked between A and C, so it's
Hmm.
also good to know that C can be used in even pregnancy. There are some conditions where you cannot use C also, specifically if your preparation has avoided in pregnancy. But vitamin A topically or otherwise orally we avoid in pregnancy and lactation. So that's also if we want to decide between these two, retinol preparations should not be used in a pregnant or about to plan pregnancy or lactating women. So that's how
That.
they are
That
they
is a
are
great.
they are both unique
Not
ways.
know about it, yeah, because people don't know about it. No, they just apply it. They don't know that being going to be pregnant or being pregnant, that they don't have to apply these things also. So that is also a
Yes.
great information. I think so. We have covered many questions. Dilpreet is asking, can I talk on WhatsApp? So you can just DM us here also. We will be happy to solve your queries. And anyone else who wants to ask any questions on skin, on diet also, and to our dermatologist, Dr. Swati, you can DM us here and we will be very happy to help you here. and there's no problem. So thank you, Dr. Swati, and a very happy Valentine's Day to you all, and all the viewers out here. May all your skin glow on this day, and you'll be happy, stay safe, and thank you very much, Dr. Swati. Yeah, just
Thank
tell me.
you. To be here on your page. Happy Valentine's Day, everyone.
Same to you. Thank you, Dr. Swati. I think so. We should end here. I
Yeah,
think so.
thank
More
you.
questions. One question is there. I think so. What about tiny face bumps? Any precautions or suggestions? Tiny face bumps. They are asking.
Okay, so see, we don't know honestly what the person is talking about. Tiny face bumps can be many things. It can
Yeah.
that is for acne. If they're itchy, they can be light eruptions. They can be areas. So honestly, the right advice, I would request to
Hmm.
specify so that we know what
Yeah.
exactly are you talking about. It's good to examine with the
True.
dermatologist so that we are more on it and give the right advice.
Yeah, that is the thing, because when you say about tiny face bumps, we don't know why it has been there. So you have to specify properly, then only we'll be able to help you out. And Dilpreet, again, you are asking about diet. Diet should be, again, healthy, balanced diet that I've talked in this only, that it should be rich in vitamins, minerals, carbs, proteins, everything should be included in the diet. But again, you have any further question, you can just DM us and we'll be happy to help you. Thank you, Dr. Swati. It was a pleasure to be with you and have your guidance and inputs on our skin routine and regime. And everything you explained was very wonderfully, very good. Thank you. Thank you.
Thank you, Preeti. Pleasure to be on Perfect Health with Preeti. Thank you.
Thank you, Dr. Swati. Nice here. Nice to be here. Okay. Thank you, audience, for being here so nicely, patiently listening. Any questions, any queries, you can just DM us. We'll be happy to solve it. Thank you.